Great evening to our public health professionals, scholars, international leaders, and intercessors from around the world. We are grateful for you joining with us this evening. Here at Caribbean Heart Inc. Speaks, our desire is to network, educate, inspire, begin to discuss issues affecting public health, community development, spiritual life, workforce development, and more that hinders communities from prospering and being sustained. So we will discuss them. We will read articles. We will find out what's going on in the news. And we will think of solutions and actually implement change. And then enable things to be sustained by using wisdom and tapping into resources that maybe we haven't always tapped in before. It is such the time, and I am honored. My name is Tessina Lynn McCreary. I am the Executive Director and founder of Caribbean Heart Inc. We are a professional public health and Caribbean community development organization. We are a nonprofit based in the United States, but serve all throughout the world, and specifically in the Caribbean. Today, there was an article that came out by the Gleaner, a newspaper published in Jamaica, and in that article, they discuss various issues that affect the Vision 2030. Now, right before I step into that, I just want to talk a little bit about the article. I have some notes here, so I'll be referring back and forth, if you don't mind. And today is Wednesday, August 12th, 2015. The article is called Fixing Health, a Gleaner special project. Miss Janet Farr is one of the authors, and she is the president of the Nurses Association of Jamaica. Now, this article is a series of articles that will be coming forth in a partnership between the Nurses Association, the Jamaica Medical Doctors Association, and Medical Association of Jamaica. And their focus is to discuss public health issues that can be addressed, things that are going well and things that aren't going so well, as they're coming together to revamp the impact of healthcare throughout Jamaica. Now, I personally always wondered, when does a nation move from developing to developed? When does that status change? Clearly, it has to be a focus of that particular nation. One of the key things is that I recently learned that Jamaica has the Vision 2030. It's their goals and their plans, their strategic development to move the nation to that status of being developed. And in this particular article, they're dealing in the area of the public health sector, using a SWOT analysis, which is looking at their strengths, their weaknesses, their opportunities, and threats that are part of a model that could help them reach outcomes and goals, and implementing initiatives that will actually shift and transform and bring forth better and more positive public health outcomes. In this particular issue, it's discussing the area of nursing and healthcare, but a lot of cases in areas of disparities. A disparity is something that hinders the outcome. So in healthcare, we want to make sure someone has access to healthcare, but not just going to a doctor or someone that has some type of medical background, but you also want to make sure that the result is beneficial. And so you want quality care. You want someone not to have to keep going to the doctor over and over, but there's something that's introduced, an intervention that can change the outcomes from that which might be a little negative that could actually add to greater sickness to that brings wholeness in the community. I am grateful to Ms. Farr and the Gleaner for even bringing this up. As a public health professional, it is vital in my eyes, especially as one who's done missionary work throughout Jamaica and of course established our nonprofit, which we go in various parts of the Caribbean to do community development and various professional public health services. We are grateful for those that bring up these issues. In the area of nursing, there was something that stood out with this article: the quality of the professionals. Sometimes when you're looking at funding, you want funding to last the whole gamut of your project. But sometimes you may have enough just to train, and then maybe the training may be skimmed. But then some results, funding is limited, adequate facilities and equipment are limited, and you want to make sure that the funding is distributed correctly. So I bring up the topic of access to care and access to quality care. How can professionals in various parts of the world turn to the Caribbean and be an asset, but also not forgetting their home base? Could it be a scholarly discussion, interchanging ideas? Can there be an exchange student program? What about not even being a student anymore? And now, like ourselves, who are now past the graduate level, earn our master's in public health, have done various works and work with organizations. What about a swap of professionals? What about learning from different communities? Um, there's also the fact that sometimes you may be able to donate equipment, but can something hinder that donation? In some cases, maybe a hospital, if they receive too much, they won't be considered that hospital or that grade level where they can receive certain funding. Is there a way to change that policy that's sitting that could hinder progress in a community? I encourage you to read the article. I encourage you to learn. And there's some conclusion in the article. They want to talk about quality improvement. They want the customers to be satisfied, the patients themselves. They need to improve the working conditions, the training, as well as the facility. If the facility is the state of the art, it helps move things go through smoother. But if they're old equipment, works every once in a while, may give false readings, the professionals themselves know everything's not up to par, it definitely affects morale and the impact of learning. So the questions are various. How can we really support? How can we help change? How? Those are fantastic. But now what do? We know what some of the issues are. We know we can do further research. So I encourage you, think about it, connect, reach out to us. We're at greaterhealth@caribbeanheart.org. Let's discuss ways how we can implement new plans. Not just in Jamaica, we bring up this issue, and what we hope to do is follow the series through, continue to talk, have conversations. There'll be definitely more coming through Caribbean Heart. We want to start this series off of different videos and conversations with these topics. Also, for those that pray, intercessors throughout the world, we encourage you to consider praying for the leadership of Jamaica. Pray for the understanding and the wisdom. Pray for everyone who's making changes in the area of public health for courage to do the things that we need to do. Pray for resources. Pray for anything that's hindering the flow of better health and greater health through the Caribbean specifically, through the United States, through Africa, through England, through Great Britain. Everything that's hindering, let them be revealed. Let there be more life. Let there be more sustainable changes. That can we be from the place of developing to develop healthy and mature. I am your host again, Tessina Lynn McCreary. I really appreciate all of us here at Caribbean Heart Inc. Appreciate you simply reaching out to us today. We hope this is beneficial for the questions that we're bringing forth. The material will have even more meat behind it as we progress forward, and we simply appreciate you reaching out. We will continue to prosper lives, sustain communities, because we are Caribbean Heart. Take care and have an amazing week. God bless you. Thank you.